Hey you guys, it's Toby from TobiTalks. I am here in Orlando, Florida at HIMSS 2019. I'm so excited to be here and I cannot wait to show you guys everything that's going on. So for those who don't know what HIMSS stands for, HIMSS stands for Healthcare Information Management System Society. This is a nonprofit organization that is dedicated to improving healthcare in quality, in safety, in cost effectiveness, and access through information and management systems. You guys, I had no idea as a nurse that this even existed. So I'm so excited to be here and I'm going to bring you in guys on what's really going on behind the scenes in healthcare and technology. Stay tuned.
Impact. I think when you step back and you think about careers and the amount of time that you put into your work, it's important that you feel accomplished, that you do something, that you are having some level of impact. I would argue that's why you're in the healthcare field, right? Is that you can contribute back, whether it's to your community, to society, to innovation, but it is about contributing and the impact.
So when we look at the issue of interoperability, when I think about it, at everything that I do at CMS, we're running Medicaid and Medicare, the insurance exchanges. But when I think about one of what I call almost like a single shot with interoperability and patients having access to their records, that's one of the most important things that we are doing that's going to have an impact on the entire system in terms of improving quality of care and lowering costs. One of the things that we haven't done in all of our efforts to lower healthcare costs is focus on patients and sort of empowering patients to be consumers of healthcare and bringing them into the decision making.
May or may not be aware, the average person sees 18 providers in their lifetime. That's a lot of caregivers to talk to and to get care from. Each of these providers and provider organizations has their own EHR and other sources of data that they utilize in the provision of care and all the things that come with the provision of care. Now, from a patient's perspective, they're like, yeah, I have data there, I have data there. I mean, it's my data, so it's everywhere, right? So everybody has access to the patient's data, right? No, not so much. As we all know, all too painfully, in reality, the patient data is completely siloed, right? Each and every provider of care has access to their data and sometimes some tentacles outside of their data, but generally speaking, are not only don't have the data for the patient everywhere they've been, they don't even know where else the patient has been. And that's generally the state of healthcare interoperability.
It really is. Right, so how do we do this? How do we make sure that we're able to take all of the hype that exists in the industry, take all of the hope that defines the very being of who we are as human beings in this pursuit of healthcare, and make it real, bring it here, right? Bring it home. I mean, how do we do this without losing sight, without being blinded by buzzwords? So how do we do this? I think it's really important when you're at a conference like this with 45,000 of your best friends to not just go in and learn tons of best practices and protocols and what's worked, but also to unlearn. I think it's important for us as we struggle with the realities of interoperability to really unlearn. How do we let go of old paradigms that really haven't worked, that really haven't produced the results with the level of urgency that we know need to be produced? So my challenge to you today is, what will you unlearn?
Clinical decision support will be driven by a range of data, and it will result in good clinical decisions by nurses and other clinicians, as well as patients and family.
Right. Maria.
Next generation clinical decision support will have to be filtered, it'll have to be organized, it'll have to be delivered in a very quick manner so that the clinicians and the patients have the ability to use it to manage the medical record.
Right. What's changed, Patty? Why this renewed focus on clinical decision support?
We now have the advanced technologies, the innovative processing methods, the rich data sources to rethink clinical decision support, to transform health and health care.
Okay. Maria.
So things like artificial intelligence and machine learning are rapidly growing and becoming popular usages of decision support and data. And then we see an increase in personal devices being used. So whether it's your Fitbit or your Apple phone, not only are we seeing patients contribute to their medical record, but we're also able to communicate back and remind them of interventions they need to take.
Hey you guys, so I'm kind of taking a little break. What they don't tell you is all the walking that goes on in conferences. So I'm a little tired, but I want to take this time just to talk to you guys about what I've seen so far, what I'm hearing so far. And a lot of the conversations is really about data, interoperability, and how we're utilizing this data to be effective to our patient care. And that even goes into the integration of technology and how technology can be helpful and not harmful. And I think it's very vital for us nurses to keep in the loop on what's going on in technology. A lot of these things are not going to also help us in the care that we're delivering, but also advocate for our patients that we're giving this care to. So I'm really excited to be able to see the different vendors and different kind of devices and technologies and transformations, and even how we're gathering data and even releasing that data back to patients and payer systems. So I'm taking this time out just to let you guys know about what I've seen so far, but I'm gonna hop back in and I'm gonna show y'all all the other vendors that I've seen so far. Okay, keep tuned.
You're going to have opportunities to influence the design of a new technology. And we need to make sure that it's asking the right question of, is this technology going to help not only everyone, but is it going to help, reduce disparities for certain groups? Because, sometimes things are developed and not thinking, because each group is a little bit different in factors and social determinants impacted. So it's a real issue.
And unfortunately for this young man, he's had complications with his catheters. So this is now his 4th catheter in 3 years. And each time we have to put a new one in, the site is more and more tender, and cleaning around it gets more and more painful for him. Unfortunately, at one point, our dressing changes for him were taking up to 3 hours of staff's time because he would become so anxious. And he's suffered trauma both in and out of the hospital throughout his life, unfortunately. So dressing changes were often accompanied by screaming, crying, being combative with nurses, trying to bargain his way out of it. And some of the only interventions I found that helped him cope were letting him have as much control over the dressing change as possible. But as most children are nowadays, he's very into technology, so I decided to introduce the headset, and he was so excited to try it out and eagerly agreed to wear it for a dressing change, knowing he could change his mind if he wanted to at any point take it off. But the headset is so easy to use that he feels in complete control of his alternate reality, and now he's empowered to trust the nurses to do what they need to do for his dressing change. And he just immerses himself in the apps and the games, and now looks forward to feeling accomplished after each dressing change. He doesn't cry anymore with dressing changes. He doesn't express any pain. And he feels a real sense of mastery over that experience now. And it's allowed us to get his dressing change time down to only about 20 to 30 minutes.
So this is our Mirage camera. So this is a 60-second live feed directly into our Mirage Solo. So if a person is, say, in a long-term care facility and they're missing their grandchildren's soccer game, somebody could stand at the soccer game, hold this up there, this feeds into this Mirage Solo virtual reality headset, and it's like they're at the game also. Wow. Yes, this gives a full world sense by turning it, and you feel like you're at the game. So, this is our Mirage Solo headset. This is all healthcare grade material that can be wiped down. A lot of facilities are working at a distraction diversion device, especially on pediatrics. Then you don't have to induce or have to over-medicate them. That is one of the applications for this. It's also very highly an entertainment device. It checks in with patients every single day.
Wow, Rosie. So these are digital nerves. Right. Wow. put in a patient's care plan, so pull it from an EMR, their meds and everything, their vitals. You could set goals, and then 60 day, 90 day, 180 day engagement. So for diabetics, and they just tap. And we've done this with 85-year-old patients. Rosie talks and you tap, and all these biometric
To our booth.
This is a pull box for medication. It sends us a signal.
Did you know?
This is a watch from Lenovo.
80% of patients stop following their doctor's orders after a month?
And you just talk to Rosie. You could do video calls from here into the Rosie platform. You could send a Rosie message, which is a little message that pops up here saying, Nurse Ann says you got an appointment tomorrow. You could call from here. And then on top of that,
You were saying that patients don't have to have a smartphone to actually have the lift service?
No, so the name of the product is Lift Concierge, and it doesn't require a smartphone or it doesn't require a Lyft user account.
Wow.
So this, again, empowers anyone to request a ride for practically anyone who needs transportation.
Okay.
And the way that we kind of complete the loop or inform the patient or the passenger is if they have a mobile phone through the SMS messages, which look like this.
Okay.
So if Starfleet Health is basically one of our MUC companies, it basically, this is what the patient gets or passenger gets when the ride is dispatched. And when the ride is matched, we send all the information about the driver. There's a link that we provide. So if you have a smartphone, you can click on the link and you can track the driver with all the details. And again, none of this requires you to create a Lyft account.
We burnt out. We tired of hearing the call bell. We want something else.
We want to help triage the calls, help you guys triage and get the right workflows and stuff to go to the right people.
Awesome. So we're not always having to run in and out the room.
Correct. The patient makes a call from the bed.
There goes that bell, y'all.
Right. So you get notification at the dome light. You also get a call assurance light at the patient station. So at Nurse Master, you open up the audio. You have your patient information here, which you get from the ADT and EHR feed. So it tells you your age, acuity level, whether you have any kind of fall risk, hurts, what can I do for you? I need pain meds. Okay, I'll send that request to you. So you can either scroll up and down to find it, or we can do the fuzzy search. And we can send that message out to the edge device, such as Spectrum University. So as you can see, it says pain medication for room 101. And we can also see that this patient is a fall risk.
Okay.
So now, if this is your patient, you can either have the feature to call back into the room and speak.
What I'm asking of our panelists and our judges today are to think about, from your perspective, what some of those barriers are, and then what advice do you have? What practical advice can you actually give nurses on how to work through those barriers to continue to push through to have success?
Is to really just find a problem and start with a really simple solution to go after solving that problem. And really listen to the feedback that you get from the market or from other nurses or from patients to kind of iterate on that product to really make it a scalable solution.
So what's the practical advice? Learn to become better risk takers. I'm in a business, venture investing, it's all about calculated risks. You're going to be making decisions with imperfect information. Learn how to do that. You do it every day in the caregiving aspects of what you do. Learn to do it in the business side.
I was going to say a couple of points. You guys have it, I'm just going to sit down. A couple of points that I think are important is you do need some structure to support your thinking, and you need time to think. Nurses are very busy, and I think being innovative and creative just takes a little bit of mind space and some thinking. So give yourself that sometimes. And number two, I love just get to the table, right? Get to the people who can help you think about these things. And I love the idea of branching outside of healthcare, because I think we're learning a lot from outside industries, and nurses should take advantage of that. Get involved with the partnerships and the people that can help you expand that thinking. So.
By a show of hands, how many of you hope to one day live in a nursing home? Oh, not surprising, right? And that's not surprising given that nursing homes are often associated with poor quality, a loss of independence, and isolation. But I want you to consider this. By the time you're 65 years old, there is a 70% chance you're going to spend at least some time in a nursing home. And I don't know about you, but I want the nursing home I end up in to offer solutions that will improve quality, to promote independence, and reduce isolation. Technology is one solution. Investment. Or what if you were a nursing home or a hospital administrator? Would having a report about IT capabilities, extent of use, and degree of integration help you decide where to invest your IT dollars or where to transfer your patients?
Introducing Technolytics. Technolytics is a web-based company designed to provide information about nursing home IT maturity. Members of our team have been conducting information and research in nursing homes for about 15 years. What we've done is created an instrument that measures IT maturity in nursing homes, and we've integrated that into a survey mechanism that allows us to provide data that can be searched by people that are interested in it.
So my name is Dee Marie, and I am the CEO and founder of MyRA, which stands for My Resource Assistant, or Myra for short. So MyRA is an on-demand healthcare staffing platform. It directly connects healthcare professionals and healthcare facilities to service their staffing needs. So a little about myself. I've been a registered nurse for 20 years now, and I can barely recall a time that I showed up at work and we were adequately staffed. And much of the time, our staffing issues were a result of last-minute schedule changes, whether it be because someone called in, they didn't show up for their shift, someone called in sick, or we had an unexpected surge in our patient census. But unfortunately, when you continuously work short, staff ends up burnt out, the patient care is compromised, and our patients end up having a poor patient experience. So currently our solution is to utilize a staffing agency. And for those who aren't familiar with how staffing agencies work, the hospital notifies the agency that they need a nurse. The agency then either emails, they phone, or they text a slew of nurses hoping that someone will call back and say they'll show up for that shift. Then the agency turns around and notifies the hospital that a nurse is going to show up. Well, that entire process is extremely time consuming as well as being very costly.
They were with me, I could comfort them, and they felt okay about being able to handle their care. But as soon as they went home, they were either worried about something bad is going to happen to them, or something bad really did happen to them. And that just broke my heart, because we're trying so hard for them to have good outcomes. So I kept thinking, what can we do so that they can be taken care of even when they are at home? Started with building videos and handouts and websites, and eventually ended up building an app that was starting to get used by a lot of people. The goal being that we are never leaving the patient's side because our patients need us. So with that started HIMSS, meet world's first AI nurse. So I literally replicated my brain as a nurse onto a solution so it can do all the things that I would do for my patients. So what are the things that it can do? So when the patient and the family is getting ready for treatment, it will help them to prepare, to do all the care coordination and education. And while the patient is going through the treatment, supporting them both from a physical needs standpoint, emotional support, care coordination, as well as real-time management of all the symptom and navigation needs. And as we see that if the patient's condition is declining, then we are immediately able to move from high tech to high touch. So me as a nurse can take over and make sure that the patient is doing okay and doesn't have poor outcomes. As a clinical person, the value it provides our team is that it's much more effective utilization of our team's time, of the staff time, and leverage the time that we have together with the patient for more meaningful use of that time, and being able to keep an eye on all our patients and be able to help the ones who need us the most.
Hey you guys, so I want to show you this wonderful diversity group today. IBM sponsored the African American SIG and all this networking. Look at all the smelling in the room, y'all. Yes, happy to be able to be a part of an organization that actually does talk about inclusion. So I want you guys to capture this. I'll talk to you guys soon.
than we and the employer gives us credit for. So search through your life experiences to actually describe and share your experience, right? I have a lot more experience than the jobs that I have done. Likewise, that is you. So start to extract and then look at your other experiences. While you're building your education, right, and while you are getting your degrees, there are other things in which you've done, right, where you can be able to pull and then share those stories as key experiences.
I would say when you talk about careers is, making the determination to say it's time to go. Because sometimes you have to make that jump, and you're scared. Might mean relocating, changing your family, but that might be the next thing that you have to sometimes consider. But also think about things you maybe never thought of. Because obviously it sounds like healthcare is a passion. You want to stay in healthcare, but there's a lot of opportunities, out there. And I would say make sure that you think of all the other things and just don't pigeonhole yourself into looking at where you're at, because sometimes you may not be able to make yourself fit, into that organization.
You talked about two constituencies, right? You talked about we're hiring people and then we're creating an inclusive workplace, and that's certainly true. Something I think IBM does a pretty good job at relative to other companies. It's the bridge that I think is important. When you're bringing new people into an organization, and Obed talked about it, when you look around, are you connected to people that you can relate to? And our responsibility, I would say, a clear responsibility of our organization to create a culture where we don't just say we're inclusive, we provide opportunities for people to connect in the organization at a really deep and meaningful level. This isn't just about, a cocktail or a potluck, right? This is about mentorship, as Byron talked about. This is about creating career visibility and transparency, and really, trying to create an environment where people are connected to mentors and role models, so that we can build that inclusive environment. So it's important, it's difficult to do, and it requires effort, and we try to do that every day.